guys, Dr. Shumard here, and today I want to talk to you more about specifically type 2 diabetes and how somebody is diagnosed with diabetes and the corresponding numbers that we want to look at and what are normal ranges as well that we want to look for also. So when you go in and get your testing done, a blood work done by your doctor, they're going to look at it as something called your fasting blood glucose. Now, if that fasting blood glucose is over 100, we're already getting the higher numbers, which is putting you at risk of developing diabetes. But the gold standard marker that we look at, or biomarker, is called hemoglobin A1C, or you may see it on your blood test as HA1C. And that's going to tell us the specific average of your blood sugars over a 3-month process. It's a gold standard currently being used, and they're averaging your blood sugars over 3 months. And essentially at that point, you can get a full true diagnosis of diabetes, because your fasting glucose could be 105 that day, but your hemoglobin A1C could be at a higher number, telling us, well, you have diabetes, you just had a better blood sugar that specific day. So you really want to look at the hemoglobin A1C. But let's start with fasting glucose. So if you have diabetes, you should be evaluating your blood glucose every day using a glucose meter or a 24-hour meter. And what you want to look at is your average should be between 85 and 100. I know oftentimes on the blood test, when you're looking at those ranges there, it says 65 to 100, but ideal healthy ranges is 85 to 100. So if you're over 100 on an average, you have elevated blood sugars, and if you're below 85, you're showing low blood sugars. On a hemoglobin A1C, there's a little more specificity there. So 5.2 to 5.6 is a non-diabetic. That is exactly where we want to be as a hemoglobin A1C. 5.7 to 6.3 is borderline or pre-diabetes. And these days, when you're pre-diabetic or borderline diabetes, you're already getting on medication because essentially they know you're going to become diabetic. 6.4 and above is considered full-blown diabetes, and that's essentially how the diagnosis occurs. Now, when you're above a 7.0, that means you have an out-of-control diabetic situation. So currently in the traditional medical model, that's how your diagnosis and how you're being managed is if your hemoglobin A1C is below a 7, they're going to keep you at the same dosage of your medication typically. But as it starts to go above a 7, you're going to increase medication, or you're going to be adding on additional medications if needed to keep that blood sugar below a 7, which is considered a managed blood sugar situation. So hopefully that helps you today understand more about blood sugar and how to evaluate that for your specific needs.